to another episode of Tech Aunties. I'm Gina Rosenthal, CEO of Digital Sunshine Solutions.
And I'm Marian Newsom.
Thanks for joining us again, Marian. And we have a guest today. I am going to let him introduce himself.
Hello, guys. I'm Ganesh Padmanabhan, founder and CEO of Autonomize AI, and excited to be here.
We are very excited you're here. We were talking about you in our Aunties chat earlier this morning about, healthcare is one of those places where we really want to know what's going on. But before we really get into this with you, we're excited to hear about Autonomize. We're excited to hear about the pitch you did yesterday for South by Southwest pitch competition. But before we get into that, we have some questions. But we've been asking everybody.
Let's do it.
All right,
spill the tea.
I'm gonna spill the tea and give some sunshine too. I think where I want to start, I want to flip it around from what we did yesterday, just the order. So we are calling ourselves the Tech Aunties, and we have specific cultural reasons that we're doing that. So we're starting to begin to ask our guests, since we're kind of rolling new and doing a reboot here. Does Aunties have any kind of meaning to you personally, and do you like our name?
Love the name, number one. Number two, I grew up in India. You call everybody aunties and uncles. Everybody's an auntie, right? I mean, so usually the only connotation is they're usually older than you, right? So that's about the only connotation. But other than that, I think, other than that, I think it's awesome, and I love it, and it's so catchy too, and I love the fact that I want to hear your reason why you call yourself the Tech Aunties too.
I'll go first, and I'll let you go, Marian. For me, it's exactly the same way. The aunties are the people. Your aunts are your people in your life that know all the dirt about your parents. So they also know that you can talk to them and about things and that you might not want to talk to your parents about, and they're gonna be on your side and be your biggest cheerleader no matter what. And I think when we're coming up with a name, that's what we saw. Especially, I've been in the industry for a while. I'm older than most of the people I work with, and I've got a lot of experience, and I know things that are going to happen. I can watch people going down that road, and I love the energy and the newness people bring when they first come out of college. And I just want to, I don't want them to have to go through the stuff I had to go through. I just want them to start at the next level and do awesome. That's for me.
That's awesome. And so for me, aunties really are those trusted people, not only by birth, but that you meet along the way, who actually help foster your journey and really take an interest in you and really tell it like it really is to you.
That's it too. Exactly.
Why do I get the feeling I'm going to cry on this show?
Oh, well, you'll be the first guest. That's going to be the first guest that cries.
You're going to make me share so much, and I'm like, oh my God, no.
I feel like that's a challenge now. So.
You should have said that.
All right, so let's so we'll shift it away from the lovey-dovey stuff, and let's go back to tech. So one thing we've been asking people here we've been asking people on video to answer this question about AI, because that's what we're talking about this week is AI. Mm-hmm. Do you think AI is a bunch of hype, or do you think it's going to bring us some digital sunshine?
It's already bringing us a lot of digital sunshine, right? I mean, the funny thing is, everyone I see is an AI entrepreneur, founder, AI operator. It's the beauty of this is this, right? Until about 2 years ago, and fortunately, unfortunately, and it doesn't give me any additional advantage, I've been in AI for over a decade now, right? And but honestly, a lot of things have changed, and things just popped out to be entirely new come 2017 because of some architectural breakthroughs and so forth. But the beauty of this, where everybody is identifying with, there's a pop culture movement happening in AI, right? It will give you the evidence of hype and all of that kind of stuff. But the reality is, today you can start a company as a founder for entrepreneurs per se, who can pick a problem without having to hire very expensive data scientists, data engineers trying to figure this out, use an API, use a credit card, and then go build something that is, very intelligent, if you will, or at least gives you a semblance of intelligence, right? You remember the moment back when we were working together back at Dell, the cloud days, early cloud days, right? The developers could go swipe a credit card, get a virtual machine, start building software. It wasn't hard to do. It is that explosion in intelligent applications that's happening here with AI. So definitely digital sunshine. Now that said, let me peel it all back, right? So it democratizes the field. There is no advantage that anybody has who's been working in AI for the last 20 years, right? People, like, in fact, when we hire people right now, we're getting really smart, fresh graduates who, for the last 2 or 3 years, they just immersed themselves in the core technology. Now, they lack the industry experience and so forth, but they're able to think about this problem without being burdened by all the legacy thought process of even how AI is done or machine learning is done, right? So, but that said, hype, there's always going to be, like, every other company you meet is an AI company. Everybody thinks there's rebranding. I was talking to, and hopefully they won't we were joking I met the city manager of Cedar Park yesterday, and we were talking about AI, and I suggested maybe you should change it to cedarpark.ai, so, and they loved it. And so there is a lot of that's going to happen,
Lord.
right? People are going to rebrand, people are going
Right.
to, reorient themselves, because there is a pop culture moment. There is definitely everybody can relate to it. 5 years ago, when I was working in AI in a different company, explaining AI was an effort.
Yes.
Now it's a ChatGPT, and then, like, I got it, right? So there is a lot of that's happening. So that's going to push. There is going to be a lot of noise. Every market like this has gone through noise. But then the net positive is that more people are talking about it, more people are getting involved in it, more people are building with it. And I think it's going to be more than just digital sunshine. It's going to be sunshine all around.
I like that. I love that. Well, I want to get back to something you said, because now you've just got me thinking, especially when you were talking about the fresh people you're bringing in. When you said they come in and they don't have to know the basics of AI, are you talking about from a machine level, an architecture level, or like how do they understand how things work? And is that a disadvantage to them, especially because they don't understand the business and you have to teach them the business problems and what you're trying to solve?
So let me clarify something I said. For builders of AI, you want them to understand the basics.
Right.
And what I mean by basics in this world of AI is, like, do they understand basics of deep learning, right? Fundamental. And we see so many people. Here's the flip side of it. I get candidates who want to interview with us. They do a really good job. We give them an assignment, and the assignment is a very simple assignment. They can easily use ChatGPT to get the wrong answer, and they do it. and it's okay to even get the wrong answer, but it is actually, and then when you ask them about, explain to me, how did you arrive at it? They really fumble because they don't have the basics and the fundamentals.
Yes,
right?
that's what I was
So
wondering.
fundamentals are critical for builders, but the average person doesn't have to build AI. They understand their domain. If they're starting a new company or solving a new problem, they understand the problem they're trying to solve. And now they have to skip the line of having to worry about getting someone who understands AI to build AI for them, because it's democratized. It's like an API call away, right? That, I think, is the one that's going to cause this Cambrian explosion that everybody's talking about.
So I like that approach, because what you're basically saying, correct me if I'm wrong, is that they have to be technically savvy to actually do the job, but they still have to have their own critical thinking and bring that value as to what's right, what's wrong, what's ethical, what's not, to the position too. So a real good balance of AI and those people skills that would be required.
Yeah, I mean, when you think about, I have young kids, and I tell them, everybody's like, STEM education is a tool for critical thinking, right? So I think it's very critical, very important. But majoring in programming languages, even system architectures, probably not the best use of human talents, right? I mean, you have AI to do that part for you. I mean, like, right now, the most, it's the most popular, the most actually it works use case in AI is coding, automated coding, right? Or like just writing code. And the reason for that, it's a constrained system. There's a set syntax, there's set, history of all those things. So the models are trained on it and so forth. I can bet you, like, people who are really great programmers today will be if you have a programming competition, algorithms will far, outperform human beings in the actual effort of coding, right? The flip side of that is actually, it's just going to follow the rules. There's no net new, in the philosophical terms, there's no net new creativity that's going to come up. So that needs to come from the human will, the human agency, if you will. But The most popular programming language today is what, something WebJS maybe, or like some JavaScript,
I don't know. It
or
depends.
Python maybe.
Maybe
right?
Python, I
Python.
would say
Probably.
Python. Mhm.
In the future, that'll be English, right? Or an instruct language that you would instruct a large language model to do the things for you, right? Now, I can go into my
Yeah, you're
thing. We'll go into so many
because
different phases.
well,
but,
let's. That's very interesting. You answered my question, so that was good. But let's talk about Autonomize AI. Let's tell us about your company and what it does. And I know Marian is ready with her questions.
Oh, I'm just passionate about healthcare, so I'd love to hear what caused you to what initial problem you're trying to solve and how you've gone about it.
Yeah, so I'll tell you a little bit about my background and how we actually came about, the origin story for Autonomize, right? So first of all, Autonomize AI, we are building an enterprise B2B SaaS platform that allows us to build these take a very complex healthcare workflow, be it prior authorization, like any of these things that are really mundane, but also very complex. There's use a lot of knowledge work that's involved in doing it, historically really hard to automate. And we actually augment the human being who's doing it, a clinical worker, a doctor, a nurse, a caregiver, with a Jarvis suit. We give them a Jarvis suit to turn them from Tony Stark to Iron Man. That's what we say, right?
Okay.
And that's what we do.
All
Now,
right.
the origin story was here, right? We started, the company was founded in 2022.
Okay.
Coming off of COVID, my background prior to that was founded a few companies, was at Dell for a long time, had been on those waves, the cusp of all the, crazy technologies that may or may not play out, and we still somebody has to bet and so forth. So we did a lot of that. And then, 2020 changed perspectives for everybody, right? What do I tell my grandkids? That I help everybody shop more and search more with AI, with all the work I've done in AI? I want to do something more meaningful than that. And what better a mission for a technologist and an engineer like me to go take all that skills, all that expertise, all that interest in that area and apply it to the most profound reason of humanity, right? Which is improve human health and human health condition, right? Mm-hmm. That was the origin story. So, and then, it was about trying to find the right problem in healthcare and AI. What we noticed was a common denominator problem across AI, across healthcare, is that most of healthcare data is unstructured data, right?
Right.
The reason for that is healthcare is heavily a services-centric, knowledge work-centric industry. Expertise is in people's brains than in systems, usually, right? And experiences, collective experience, and so forth. The data they generate, the notes they write, the research they publish is unstructured data. Right. So, but this becomes a loop problem, right? Wherein they create this unstructured data, but for you to actually understand what's in there to make decisions with it, you needed humans to do it again. Mm-hmm. So driving efficiency, and we saw this in the evidence of your knowledge worker shortage during COVID and beyond. Still, actually, everybody's reeling. We spend close to $1 trillion in the United States on manually administering care. This is the paperwork, this is the faxes, this is the review. I have customers, health plans, insurance companies who employ thousands of nurses and MDs who are not taking care of patients. They're reviewing charts, they're making administrative judgment, they're helping risk adjust better and stuff. All of that is like, if you can capture, and today, it's possible that AI is at a place where you can actually understand multiple modes of data. And if you can figure out the way to pair content with the context in which you want to make that decision, you've unlocked gold, right? Which is what we did. We actually built a platform that can pair content and context. And the context could be care management. The context could be, care optimization. The context could be clinical research, right? But being able to contextualize the data that you transform from unstructured to structured, pair it with the context, that's what Autonomize does.
So can you walk us through like a real example? So like, I've got AFib or like a patient's journey that I know what a pain in the butt that was to, get this solved and get everything
I'll
fixed.
give you a very simple example, right? We all have to go through, let's say you want to go through a preventative MRI to scan for breast cancer. Your doctor has to compile your medical information, fill out a form, sometimes years or months or years of actual medical history, and justify to the health insurance company that you need that approved. It's called prior authorization,
Oh yeah, know
A
about that.
nightmare.
right? And so this is a classic problem we solve. That they fax this request over to the health plan. And the health insurance companies employs that hundreds and thousands of nurses and doctors who page by page look through it, review it, summarize your medical history, that 600 pages of history that your doctor sent, then adjudicate that against millions of pages of clinical guidelines looking for medical necessity, evidence of conservative therapy, because they have to manage utilization. As they get paid if you utilize less medical resources for the healthy population, that kind of stuff, right? So that whole process, you're waiting on the decision for 3, sometimes 4 weeks. They're spending hundreds of thousands of dollars, sometimes hundreds of millions of dollars a year, just doing this administrative work. It's a classic problem. What we do at Autonomize, for example, we sit on the health plan side. The faxes hit the fax machine, or like the digital fax machine, like a software comes in to sit in a blob store.
So it's
PDF
not the
files.
noise and everything going through.
No, we've gone away from that a little bit, And then we extract that information, using vision models, transformer models. You understand your patient history, the diagnostic, check for eligibility, automate the whole checks around it, summarize that 600-700 pages of data, and then automatically create, we have all those, we call it agents, multi-agents. These agents, one agent goes and checks all the clinical guidelines in a pile of PDF documents, finds out the right thing, creates a compliance report, and helps the nurse go and say, yep, this is the patient's history. This is why they're requesting it. It meets the guidance and criteria. Let me hit approve. The whole process that takes they take about 60 to 70 minutes to review a case, a complex case.
It's incredible.
Seconds, right? So to me, as a classic example, on either side, the provider and the payer, it's cost savings for administrative work that they would otherwise have to do. But the flip side of this is you're also doing it at a higher quality, right? Because humans get tired, humans make mistakes,
Right.
They're overworked, right? AI doesn't have any of those problems, right? But the beauty on this is also like, can you automate this whole thing? And I know where you might be going with that question and all of that stuff, but theoretically, yes, but practically, no. You have to have the human in the loop for these high-risk decisions that you're going to make so that you're bringing the best of everything, right? You're augmenting what's really unique about that doctor or the nurse who's making a decision with their inability to process all that information in one go to make that decision, right? So it's a best pairing of humans and machines to transform.
Okay, so hit him with the hard questions.
Uh-oh. This wasn't the hard questions?
No. So I imagine the reception among the payer community has really been huge, because I remember when I used to do HIPAA compliance, their margins were something like 8 cents on the dollar. So I could see where they would be very receptive to it. And I do agree that there are complex issues in healthcare, especially with that prior authorization. And everybody's unique. I've actually been called a genetic freak, waiting on a prior authorization. And so I love that you picked that problem to solve, because I think it does have an impact not only on how healthcare is administered, but also allowing them to kind of take some of that back end and really focus it on the patient more.
Absolutely. And I think, this is the Tech Aunties, so I can go even deeper on this, right? So let's say we solve that prior authorization problem, which we do for some of these health plans. The next step in the process is that same data that you used to understand the total medical history of that patient usually is a throwaway data, because you use it for making the judgment and you forget about it. Another group does your risk adjustment, another group does your care management and so forth. Now we have already transformed that data to having a 360 view of that member, of that patient. You can use that to improve your risk adjustment practices, do better care delivery, manage your care plan a lot better, because claims data is very backward looking. It's after the fact, right? So medical data, you combine all this, and like now with all the programs that employers and health plans do around wellness and digital devices and so forth, you can truly bring that preventative medicine, the whole total health care to life that wasn't possible before, right?
Let me ask you this, because we were talking about just this in the Tech Aunties thing before, and I was complaining about my healthcare insurance partner with somebody that sent me a blood pressure monitor. And when I got it, like I was like, okay, yeah, I need a new one. This would be great. Like, but I use an app to keep all of my data together so that I'm well informed on my own. This thing doesn't have Bluetooth. It's only sending the data back to the partner of the health company. So for me, I stopped using it because I'm like, I don't know what you're doing with my data, and that sucks. And I don't know what to do with this thing. But that's my question kind of that I wanted to get at is, okay, that's great making this 360 view of me. But do I need to consent to any of that? Or do I need to be worried about any of the data that's being coalesced, and do I need to be worried about any of that?
Right, and its ethical use and its protection.
Yeah.
Yeah. So us at Autonomize, we don't touch non-consented data, right? It's like, but the consent is the responsibility of the health plan or the provider who's actually doing it. We're a software capability to help them understand that better. That said, I think, the broader question of, being able to, like, will my data be used for things beyond what's good for me? There's a general question.
Yeah.
Go ahead and preach that,
Right?
Ganesh. Go ahead and preach that.
And I don't know the answer to that, to be honest with you. I mean, I'll be, it shouldn't be like used for anything that is not, useful for me. And I think there's enough systems in place to safeguard for that,
I hope so.
right? I mean,
Well, we hopefully they learned a lesson from Henrietta Lacks' story, right? Because
Right.
that was the story, if you guys haven't heard that, of a woman who had like a really aggressive form of cancer. And if you've been treated for cancer, you probably are beneficiary of literally her cells, because
Right.
they've been used to study almost everything. But she died in poverty, and her family didn't. They're impoverished, on that line still.
Right. So they didn't
While
even really realize the legacy.
They never really see the legacy, but they also
DNA, of her
right
DNA.
of her DNA and of her body being used
Right.
literally. But the companies got rich off of that and are charging other people for this information. I'm sorry to bring the downer on it, but I think hopefully that's where they've learned something. But that's where my mind goes, is like, I don't think I care if you have my high blood pressure data, but maybe I do care if you have it. And if you have this data, if I eat French fries 3 days in a row, are you going to cut me off from something else that I'm having?
So I think, like, for example, it doesn't matter. Like, one of the things the Affordable Care Act did, honestly, was actually to hold that whole, it kind of evened out the landscape for doing at least seemingly bad practices for anybody, health insurance companies or this thing. Now, there's always going to be things. I mean, like, AI is an accelerant in a lot of ways.
Oh, yeah.
Including in, like, there's an old book by Kathy O'Neill called Weapons of Math Destruction.
Oh, that's such a good book.
It's an amazing book. And it was like a big data era. It's not an AI thing, but now it's supercharged, right? So you can use the same data in a good way or the bad way, right? Mm-hmm. And the data is not at fault, nor is the AI. It's the users who actually intend to use it one way or the other.
I agree.
Right? So the governance that we need to actually apply is actually more on the actors themselves, right? Like, who actually take it? How do you look for intent? How do you actually there is so much. Autonomize started in clinical research. So I'm very familiar with some of the problems that we're talking about, right? The pharma companies who actually, the one hand, you're right. Like, they're profiting out of this whole thing. But the other thing is also the number of lives they impact is also in there. Now, price of drugs in the United States is more than anywhere else in the world. That is true, right? And so to me, that is a function of the incentive system and not so much about if you were, I might get into so much trouble.
Well, don't get into trouble. Don't say things because you're going to get in trouble for it. We're good.
Leave it. Let's table that conversation.
There's a lot you could go down lots of roads, and there's lots of legal issues around it. We know all of that. We don't want to get you in trouble. So let's talk about, I think we've got just a little bit of time left. Let's talk about your pitch, because you were a finalist in the AI category for the South by Southwest pitch competition. You pitched yesterday.
I pitched yesterday.
And?
It was, we'll find out today what happens to the results of it. Right. But, the results honestly doesn't matter. We were one of the 5 companies that were selected off the tens of thousands of applicants that they got. So that itself was a huge honor for us. So super excited. We had fun. I had so much fun doing that pitch, right?
Okay.
I could tell the story of prior authorization. I took that as an example to just relate to everybody. Yes. We talked about a little bit about like our traction in the last 2 years that we have. We grew our annual recurring revenue 20 times last year.
Oh my gosh, that's
So
awesome.
it was
Congrats.
So the good news, I'll tell you the couple of things, right? One is healthcare is such a regulated, hard industry on the outside to actually go and break in and stuff. But the problems, if you solve them well, and if you solve them really well, it's a huge economic opportunity in addition to doing good for everybody, right? So, and we think we have hit a nerve in the industry, solving real problems, going beyond like being a thin layer over ChatGPT as most others are, right? To really go in and say, like, how do you go to the heart of the problem? Like prior authorization, nobody wants to touch it because it's a regulated workflow, it's highly inefficient, and it's required and hated on both sides, right?
Exactly.
So, but we just dived right in and say, okay, let's break it down. What are you solving for? And then we say, oh, your intake process takes too long. Somebody has to review and type in this thing. Oh, we can automate that. We can solve that.
Right.
And then it goes, so this adjudication process takes too long. Like, okay, we can use generative AI, some compound AI techniques to go do that, right? Being able to really go into the workflow and make a difference is what's helping us. So the pitch was great. We had some amazing other finalists too in the category, and I was just like so much creativity in the world, right? There was a company that was doing, they understood lyrics, so music AI, but which has the ability to understand lyrics, sound, and the melody, which is the lyric, right? Which was, if you really think about it from a data perspective, it's really multimodal data in just one thing that we would otherwise associate with sound, right?
Most definitely.
So it was crazy. It was awesome.
Exciting things are coming out. Well, I don't see it. Do you guys have anything you would like to ask Ganesh, our audience here this morning?
Okay. Hey, Ganesh.
He's going to give you a microphone real quick.
Hey, Rehan.
All right.
That will
So,
change my voice. We don't have AI inside the room. We're good.
yeah. So I didn't get the pleasure of attending your pitch, but it sounds like it was awesome. And what you guys are doing is great. One thing that I'm noticing in any healthcare company that's been coming out is it'll be a great solution, it'll be a great product, but it's siloed sometimes. So you talked about governance, right? It's still the same problem. We have an architectural problem. We have a data exchange problem, right? So what are you going to do to be yeah?
No, it's a great question. In fact, I'm glad you asked that, because one thing we noticed when we were starting the company and we started getting early traction was healthcare is a land of silos, right? In terms of data silos, even including the last 10 years of digital health innovation has been in narrow silos, vertically integrated products that go top to bottom. What does it do? It creates another data silo for the health plan or the health insurance company. Now you have to go ask for more permission to get access to that data and so forth. Architecturally, one of the things we fundamentally focused on is first focus on the data. So we built out a data platform that transforms unstructured data to structure. And then we have a couple of these different modular capabilities in there that allows you to actually pull it together to go deliver a copilot for workflow 1, workflow 2, workflow 3, because that's when you really can go in and compound the value of data across multiple use cases. So that's one thing that we're doing. The second thing that we're doing is the interoperability problem, right? Which is like we do prior auth for providers by making sure that they actually package the auth request in a way that can be delivered successfully and will get approved, saving them administrative overhead. We do the same thing for payers on the other side. Now, there may be a future when you're on both sides, you're having data cleanliness is a big problem, but maybe in the future, there's an opportunity where AI is packaging data, AI is reviewing data. It's a lot easy thing to share and converse about than, having to deal with a lot of humans and getting permission and all of that stuff and, politics coming into play and so forth. So there is that interoperability play that I think everybody's motivated for it, right? Rather than 5-6 years ago, health plans didn't care about, they cared about it, but they didn't care about the provider data. They wouldn't get access to it. Now providers are saying, okay, we have data. We want to go into more, let's say, value-based care, at-risk plans. So for them, it's important that they get access to other parts of this patient's journey outside of their health system, which is something sitting in claims data at health plans, or it is in some social economic data sources. So everybody's opening up. Obviously, the governance, the framework, making sure the intent of use. Like even today, like the use of data, you can get access, the fire data, like through a thing, but you have to very clearly dictate and talk about the intent of how you use that data.
Right.
And, and there are systems in place. Now, Is everybody following it? I don't know, right? But I think a lot of the building blocks are coming into play. We saw the opportunity to build a technology platform to actually go make that building blocks just snap into place, and we can actually deliver value at scale. I'm sure there are others looking at some other parts of the stack and saying, okay, can we just build the pipes so that the data moves freely and stuff like that? So I think it's going to happen, whether we
So do you
do it or not.
worry about the platform, or do you have, let me ask you this way, have you put safeguards into the platform, or do you think these are necessary to prevent people from getting locked out of care?
No,
And you know what I mean by that?
absolutely. No, absolutely. Look, I mean, ours is not a clinical decision-making platform, if
Okay.
you will, right?
So that's
Whereas
the safeguard.
That's a safeguard, number one. Number two, most of our workflows are with human in the loop today,
Yeah.
right? Number three, we have a set of trusted AI guidelines that we adhere to. It's actually on our website. You can check out at autonomize.ai. Patient-centricity is a huge factor here. So end of the day, there's an arbitrage of different incentives. Go and focus on delivering, on the patient, right? Deliver patient-centric care. So things like that. Now, I think, end of the day, we're a small part of the total ecosystem. So there's a lot of that thing. So I believe that we can, companies like us can influence a lot of that behavior too.
Yeah, I think so too. I think it's interesting hearing, what kind of caught my ear was in the last couple of minutes was, that platform idea. And that's the transformation is the platform itself. And I can see that being, there has to be a way to get the unstructured data to a structured format to then build algorithms that can help humans make the decision in this case, which I think is a great way to do it. But I think that's where we're going. So like we went from the internet, from digitizing everything to now we're building these platforms to actually making sure we categorize these things,
And it's very innovative in the healthcare space because not only are you going from that basic electronic record, that medical record, now the payer can actually have more better communications, better data exchanges with the payers. And that's where that consent really should lie. Because they're taking the data, they're collecting it. They have the initial responsibility to protect it and make sure I'm giving implied consent as to how my data is being used. His use case should be included in that. So I love the business model. I love the way that you kind of put that responsibility where it should be. My relationship is with the payer and the provider, and that's where
And
that consent should
eventually, I mean,
happen.
there is definitely a consumerization of healthcare that's happening.
Most
right?
definitely.
Most people are getting more informed. It's easier to be informed than it was before, right? So there's definitely that. And I think, the eventual view on this is like, today we're doing this like, hey, you have X amount of clinically competent people who are making decisions. There'll be a class of AI that'll actually be as good or sometimes better than that class of people in the future, right? So then you go from co-pilots to autopilots to go doing this. When there's enough trust in the system, there's enough fabric, of compliance and governance all put in place. That's when real magic or real transformation happens, right? I mean, like it's the Minority Report of the future, right? So when you
Right.
go in and like I shouldn't have to think about like, automatically when I open the fridge, the food that is healthiest to me should appear in front, right? At some point. It'll happen in the
You
future.
have to have
But
the
it's
healthy
headed that way.
food in the
No,
fridge for that to
because
happen.
they'll have a pipe directly from the grocery
What are
store.
you-
They'll push the food in.
Right.
So I open it, I get it, it puts it out, and there's a robotic arm that cuts it down for me. It's like, eat fruit today.
Wow, Ganesh, you are out there.
But it's not far off track. You go into HEB, right? They have the pharmacy there. You're there. They're collecting that data at the pharmacy. They have their loyalty card. They're collecting the data on what you're buying. You take it home, and
One of the most common
your smart refrige even tells you, "Hey, you're out of this."
one of the most common use cases we hear from our customers is like, hey, can you get access to some kind of a retail-oriented data of the consumer? Usually from shopping data, grocery data,
Yep.
things like that. Most large retailers have a pharmacy. So they also
Yep.
have the pharmacy data and the consumer data. And then can you apply that to my total care plans? To say, your care manager of the future is going to tell you what groceries to buy, right? And if you can make that easy,
But are they going to tell you can't have ice cream anymore?
I don't know.
See,
You know,
I mean, that's
you
what
can
I'm trying
have
to say.
non-dairy ice cream maybe
Like,
with a little less sugar, but I don't know.
well, it's my birthday and I want ice cream and a cupcake.
But maybe you can
So,
have it. Yeah.
I don't know. What if they cut me off and I get up to HEB and they won't ring up? What
Well,
happened?
that would be a little too much. I think, you know, the one I would just leave you with this, right? I think what makes, you know, human beings really unique is our agency, right? The will to make the decisions, and, you know, and AI is, you know, despite all the AGI crap that's out there, right? We're not even close, right? I mean, just a simple thing. I think it was Jan LeCun actually posted 2 days ago or something. He talks about like, you know, text, as in like every large language model is trained on text, right? And the reality is, and I'll tell you this, LLMs will not solve all your problems. They do not solve your problems right now, in fact, right?
Parrots.
Because it's limited, because
Right.
it is still limited in the modality of text. Vision, for example, like video or vision, imaging, video especially, has got a lot more richer data. It's a higher bandwidth modality than a text modality, right? And then so there is all this evolution that's going to happen. AI of today is not going to be the AI in 2 years, right? It's going to be a lot of evolution of how this actually plays out. And I think and we might get to a point where it seemingly starts looking like AGI and stuff, but it's still hard to actually, you know, replace human agency to do things, right? You can have rules that actually act like it's, you know, it's got the consciousness and so forth, but the reality is, I think what makes it really unique is, think of AI as a bunch of bag of tools for a bag of problems, as they say, right? That was actually coined in the 1960s Dartmouth conference, the big AI conference, the first AI summer. And the whole idea was like, AI is a bag of tools for a bag of problems, right? And which is, you
We
know,
need to
I
get
think you
back.
now have a lot more tools.
Yeah.
That's
We need to
about
get
it.
back to that way of thinking, because that's definitely not how the hype in the market is going. But it was really great to have you on Tech Aunties. Thank you for coming and visiting with us this week while we were here with the Capital Factory House. Do you have anything you'd like to pitch? You doing anything? I know Autonomize AI, but is you doing anything else outside of that too?
Well, I also do a podcast called Stories in AI.
There you go.
So would love to, you know, I usually talk to innovators in AI, usually in a larger, because the harder thing to get is, you can always find a founder willing to share their story. Harder to find a chief AI officer who wants to say, here's how we think about it.
Yeah.
So that's what I try to do.
Oh, that's
there,
really
right?
good. I like
so
that.
we have, like, I've had several folks, including chief AI officer of health plans, hospital systems,
okay.
pharmaceutical companies that all come
You
on.
can hear
it,
what they're
right? So
doing.
you can hear what you're doing. It's a good resource for founders and you know, investors too, right? You kind of get an idea, but it's so. I did it because, you know, it was like the nuance of actually what's beyond the theory and what's beyond the GitHub link is a lot more in an industry like healthcare. And it's not just healthcare, it's all industries too in the podcast. So you get a real good nuance. The hardest problem is not about building the best gradient descent model. The hardest problem is actually getting the business to buy in to push this into production, right?
Exactly.
And the hardest problem is actually just making sure you're wiring the feedback loop in such a good fashion that the business feels that they're getting slightly better improvement month over month or quarter over quarter.
Right.
Those are the harder problems in AI, right? Most of the problems are human problems. It's not tech problems.
I believe that
Right.
too.
Right.
Okay, so where is this at? Do you know the URL?
Oh, it's storiesinai.com. You can also get it on, there's a YouTube channel.
Okay.
It's also on all of your
There
Spotify,
you go.
Apple Podcasts, Google Podcasts, and everywhere. So
That's great. Well, thank you for joining us. Marion, do you have anything last comment?
No, enjoyed the interview and nice to meet you.
thank you, Marianne. Appreciate it.
Yeah, thanks for coming. It was great. And thanks y'all for joining us. We'll have another podcast episode up soon. But if you're looking for this, if you're looking for us, you can also subscribe to the Tech Aunties podcast on any of your favorite podcast providers. And techaunties.com has the rest of our information there. See you next time.